Have you ever seen an athlete suddenly collapse after making a quick move, no contact, no collision, and immediately grab the back of their leg? That might have been an Achilles tendon tear, and it's one of the most serious injuries in sports. Welcome back to the channel. Today we're breaking down one of the most devastating injuries an athlete, or anyone, can face: the Achilles tendon tear. We'll look at what it is, how it happens, how it's treated, and what recovery looks like. Whether you're an elite athlete or just an average weekend warrior, the Achilles tendon is the thick, cord-like band that connects your calf muscles, the gastrocnemius and soleus, to your heel bone. It's the strongest and largest tendon in the human body and plays a crucial role in walking, running, and jumping. When you push off the ground, whether you're sprinting or just going upstairs, the Achilles tendon is doing most of the work. Despite its strength, the Achilles tendon is surprisingly vulnerable. Tears often happen when there's a sudden, explosive movement, a jump, a sprint start, or a change of direction. In elite sports, think of basketball, soccer, or track. In everyday life, it could be slipping on stairs or trying to catch yourself from falling. Most tears are not due to trauma from another person. They're non-contact injuries. Common risk factors include overuse and repetitive strain, lack of stretching or proper warm-up, previous tendinitis or degeneration, sudden increase in activity levels, use of certain antibiotics like fluoroquinolones. When the tendon tears, people often describe a pop, like a rubber band snapping, followed by immediate pain and inability to push off the foot. Some say it feels like being kicked or hit in the back of the ankle. Swelling and bruising follow quickly, and walking becomes extremely difficult or impossible. Doctors diagnose it with a physical exam, notably the Thompson test, where squeezing the calf doesn't move the foot, and confirm it with imaging like an MRI or ultrasound. Treatment for an Achilles tear typically falls into two paths: surgical repair. The tendon ends are stitched back together, preferred in younger or athletic patients because it reduces the risk of re-rupture and allows quicker return to high-level activity. Non-surgical treatment, often used in older or less active individuals, involves immobilization in a boot and physical therapy. Can have a slightly higher re-rupture risk, but avoids surgical risks like infection or nerve damage. Both approaches require patience, discipline, and a long recovery. Whether surgery is performed or not, the recovery process is significant. Weeks 1-6, immobilization and gradual movement. Weeks 6-12, physical therapy to regain strength and flexibility. 3-6 months, light activity, low-impact workouts. 6-12 months, return to sports or intense activity. Athletes may not be fully back to their old selves until the 9-12 month mark, and even then, some never regain their full performance level. For elite athletes, this injury can be career-altering. It's not just about walking again, it's about regaining explosive power, agility, and mental confidence. Take NBA stars like Kevin Durant. He returned after about a year, but the road was grueling. Not all athletes come back the same. Some lose speed or confidence in that foot. For a sprinter, for example, that could mean the end of a career. For regular people, the focus is on regaining function for everyday life. Most will recover enough to walk, hike, and even jog, but they might notice long-term stiffness, reduced strength in the leg, or less push-off power when running. Even after recovery, the tendon is never quite the same. Scar tissue, decreased elasticity, and muscle imbalances can linger. There's also an increased risk of re-injury, especially if rehab isn't followed properly. For athletes, it could affect performance, contracts, and longevity in their sport. For regular people, it might mean adapting to a new normal with modified physical expectations. Achilles tendon tears are one of the toughest injuries to face, physically and mentally. But with the right treatment and rehab, recovery is possible, and many people do come back strong. If you found this helpful, hit the like button and consider subscribing for more breakdowns on sports science, injuries, and recovery stories. Have you or someone you know dealt with an Achilles injury? Let me know in the comments below. I'd love to hear your experience.